A health alert about measles in Michigan. New numbers just out today show that there are 10 confirmed measles cases in the state. That's the highest since 1998. All of the cases appear to be on the east side of the state. The CDC is calling this a measles outbreak in 21 states now nationwide. There have been 107 cases reported this year. That is about the same amount reported all of last year.
Brian, I'm joined right now by Dr. Bill Bush from DeVos Children's Hospital to talk a little bit more about measles. So those numbers are a little surprising, really.
Yeah, we have most of the children and even adults in our community that are vaccinated to prevent measles with the MMR vaccine. So we haven't had a case here. But yes, there are cases that come in mostly from people traveling out of the country.
So you think it's from people traveling out of the country? You had mentioned in the Detroit area had to do with the airport.
Right. So people come in from other countries. If they've been unvaccinated, they have risk of the disease. There are other people are at risk, especially those that might be immunosuppressed. But most of those really realize that they're on chemotherapy or that they have some other immune problem.
Now, this recent spike in cases, you hear a lot of people talk about shunning vaccinations. What's your message?
Yeah, so the message is really to consider those risks. The diseases that we can prevent with vaccines, not only prevent children from dying, but it also spreading to unvaccinated babies who can't yet receive their vaccines, adults who are at risk as they get older of getting diseases that their immunity may have now decreased as they get older.
What are some of the symptoms if you think you might have measles or have been exposed to it? Right. What are you watching out for?
Yeah, so we're really looking for a collection of symptoms that happens initially, and those are runny nose, cough, fever, and really watery red eyes. And that comes before the rash that kids get with measles and adults.
So again, that's really dangerous for kids, especially 5 and under.
Yeah, so the little kids don't have the immune system that we do as older children and adults to fight off things. And so that's why we start vaccinations for the measles at 12 months. Now, if you're going to travel international to a country that is known to have measles outbreaks, we actually give that first vaccine as early as 6 months.
Okay, and it's important to note too, you can get that vaccine at any age other than very young.
That's correct. Under 6 months is at risk. So we talk about, with families that ask about international travel, where are you going to travel? Check the cdc.gov website, and it tells you which countries have what diseases that are prevalent and in outbreaks.
Yeah, it's important to note for sure. Dr. Bill Bush, thank you for joining us today. We appreciate your time.
Thank you.